This call is being recorded.
Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have Allison Rosen, MS. She's at the Baylor College of Medicine and the Duncan Comprehensive Cancer Center. So, Allison, thank you for coming. How are you doing?
I'm good. Thank you for having me.
Yeah, tell me what's within the world of cancer. What is your focus? And then I want to ask you a little bit about how you got here.
My focus right now, I worked in oncology research for about 12 years in cell and gene therapy, and then I recently, about 2.5 years ago, switched over to work in cancer prevention, so outreach and education within kind of the health disparities realm here in Houston. And I did that because I went through cancer myself and am a colon cancer survivor.
Oh, man. So what, and working in cancer for so long, you were working in the, I guess, the treatment side. Now you're working in the prevention side?
Yes.
I guess straight to the point, is there a way you believe to prevent some or all cancers, or what's your overall thoughts here?
We work in our office specifically on the types of cancers that there are screenings for. So cervical, HPV, colorectal, and breast cancer. And then we go out in the community, obviously, and promote, skin cancer prevention with sunscreen and a few other things. But I think colorectal cancer is preventable through screening for sure, because any of my friends that have gotten the screening that they are supposed to get at the age they're supposed to get, they've found precancerous polyps, they've gotten them removed, and then they're done. And, if they don't find anything, they have to wait 10 years they wait 10 years to have a colonoscopy again. But then if they find something, depending on what they find, it's 3 to 5 years. And being a researcher, a previous researcher, you know, just based on the gut and the microbiome with the older population, now it's 45 for screening based on recommendations from the American Cancer Society, but 45 and above should be screened, and there's a very simple take-home screening test that can detect microscopic blood. And then if that's positive, then they move on to get a colonoscopy. And I was actually 32 when I got diagnosed. So I was quite young, and insurance might not have covered my screening, but I was having symptoms. And so if you're younger, the big message that I always advocate for and talk about when I'm in the community, even educating providers about their 45 and above population, is that if you have a patient that comes in with symptoms, rectal bleeding, their bowel habits have changed, unexplained weight loss, anemia, different things like that, I think that they should send them to GI to get screened, or even give them the screening just within their PCP's office so that, they can see what's going on. And this FIT test can pick up that blood. And if it doesn't, then every year after that, you have this specific screening test. But that's a way that you can prevent colorectal cancer. And the more people know, all ages, the more I think we can prevent this cancer. Now they're doing research now to figure out why specifically colorectal obviously is my area of expertise, but they're doing research now to figure out why people are getting it at an earlier age. The 45 to 50 year age was just recently last year. It was lowered from 50 to 45 due to research showing an increased incidence in that specific subpopulation. And eventually, the more research funding we have and the more scientists can figure out why people are getting it, then hopefully everyone that is having these symptoms will not have an issue getting the screening that they need if they think something is wrong. And, with cervical cancer and HPV, there's vaccines that you can get, and they're not mandated by many. Some districts have them. In Texas, it's not required for students to go to school if they get this HPV vaccine, but it can prevent a lot of cancers later in life. So it's between 9 and 11 years old that your boy and girl should get these vaccines. And I'm a big proponent of that too, because if you can prevent multiple cancers from developing later in life by getting a vaccine that is harmless to your child, then I think you should do that. And then you have breast cancer.
What do you mean? What kind of vaccines for?
There's an HPV
a
vaccine.
little bit about HPV.
I'm not an expert in that field, but I can, at least from what we do within our office, we work with physicians that kind of educate primary care physicians as well, so that when children come in for their wellness exam, they get their normal vaccines that they need to go back to school. But then there's human papillomavirus that they can get as well as sort of an option, and it can help prevent multiple different types of cancer. And research has shown that later in life. And you get it before you get these vaccines. You're supposed to get them before you're sexually active.
Okay, got it. And continuing on, you're saying?
Well, with breast cancer, there's mammograms. So mammograms can show early detection of cancer, or at least pick up different things. So, your doctor at certain ages, you're supposed to get these mammograms. A lot of the prevention is, obviously based on your genetics and based on your family history, and just kind of having a knowledge of what to know and to look for. So let's say someone in your family had breast cancer. You should insist on having mammograms earlier than they were actually diagnosed, because it just didn't happen overnight. And same with colorectal cancer. If someone in your family has been diagnosed with it, you should have screening 10 years earlier, because colorectal cancer historically has developed within 10 years.
Well, if you are found to have cancer in any of these, with any of these assays, does that, it's not going to prevent it. It's just going to, it's a screening, really, right?
Well, early detection is key, really. So certain screening tests can pick up cancer, or, in the case of colorectal cancer, precancerous polyps can be detected early on. I've met quite a few stage 1 colorectal cancer survivors, or patient survivors, whatever you want to call them. I call everyone a survivor based on from their first day of diagnosis. And so 90% chance of survival and full remission with stage 1 versus, not as high of a rate for, stage 3 and 4. So it's when you have these symptoms, when you're 50 and above, it's a part of your wellness exam. And, people say, I don't want to get the colonoscopy because I don't want to take a day off of work. I don't want to drink the prep. I don't want to do clear liquids. Well, personally, I would do anything to have, had the screening earlier, so that I wouldn't have had to have gone through my cancer treatment. The 2 days of, clear liquid / drinking a prep and going in for a procedure are so much easier than chemotherapy, radiation, and multiple surgeries.
Well, right, that's true. When people are showing, a problem on a screening, how often are they able to be helped?
Say that again.
I know it depends on their stage and everything, but
yeah, no. If you end up getting screened and it shows that there's blood in the stool and you have a colonoscopy, the sooner that that you can get in to have that colonoscopy, there's not. I don't know the specific research as far as you find microscopic blood on a FIT test, and you go to colonoscopy, what the stage is, but it's just early detection. So, right when you turn, I advocate for 45 now based on American Cancer Society's recommendations. Insurance doesn't always cover that depending on where you live. But when you go in and you get that, then the research shows that the likelihood of developing colorectal cancer or picking it up earlier is exponentially higher than if you wait. And that's based on research. Yep. That usually it's in this 45 and above population.
Well, in addition to screening, what about actual preventative measures? Do you know of any in the research, or they don't really know if they found any? Yeah. So when we're out in the community, we say limit your red meat. That's not really good for colorectal cancer. A healthy lifestyle, eating real organic food, exercising. Just sort of healthy habits in general. So exercise, diet, wellness, kind of know what you're consuming. And red meat is not very good for colorectal cancer. No, that's not everybody, but just in general, if we are healthier, the likelihood of developing cancer is smaller.
But, I have friends that were marathon runners and in the best shape of their lives, but they still developed colorectal cancer. So it's not always, the healthiest of people, someone that might be overweight that might develop or colorectal cancer. But in order to have the best chance of preventing cancers, healthy living is definitely the way to go. I think real food versus processed food in general is better for, besides cancer, just your life and different diseases overall.
Anything interesting from your research? Any new treatments that are coming?
Well, so my research, my research was, I worked in a leukemia research lab. So it's all about cell and gene therapy. And with that, specific, it's been a while since I've been in the lab, but really, I think, as a cancer survivor and someone that works in oncology, there are genes that are coming out every single day that are involved in pathways for different types of cancer. So, it's ever evolving. And so the funding for oncology and cell and gene therapy is so important because, I had a genetic test when I developed colorectal cancer, and it showed that no genes were involved. I had breast cancer and colorectal cancer because I have breast cancer on both sides of my family, and no gene was involved. So for me, it's like, okay, the gene hasn't really been figured out yet as far as what might have been involved with me developing cancer. So I think constantly, when I was in the lab, they were studying different genes and the pathways, and it's so complicated. So the more funding you can get into research for cell and gene therapy, the more they can figure out what genes are involved and how there might be targeted therapy specific for genes that affect different types of cancer to help in treatment.
So your thought is that it's mutation in genes is what causes cancer? Or are there other mechanisms that you come to see?
I think that definitely has something to do with it. Not all cancers are going to be genetic, but the ones that might be genetic or different genes that are maybe mutating or the change in the microbiome, all of that could possibly be related to genetics. I think that we have a long way to go to figure out why people get cancer, who, when, how. There's not really a definite explanation, but researchers are working really, really hard to figure out why. I know that in colorectal cancer, they're studying the gut microbiome and trying to figure out what is going on in there and why younger and younger people are developing this disease. And, it might have something to do with the food that we're eating, it might have something to do with environment, but, I think the jury is still out as to why, but there are some amazing people all over the world that are trying to figure out why, because, you can do as much as you want as far as treatment, but until you get to the root cause as to why people are developing the disease, then it's hard to advocate, and it's hard to, targeted. I think targeted cancer treatment is the future. Now, when that will actually happen, I don't know if it will happen before my lifetime or not, but I really do believe that the genes that are made up of in our DNA are ever changing in different ways. And, the more they can study it, it's so complicated. But the more they can study that, the more people can figure out why people are getting all sorts of various diseases.
You mentioned the microbiome a couple of times. A lot of cancer researchers don't. What's new with the microbiome, and how does it affect cancer, in your opinion?
I think the microbiome in colorectal cancer is it's mainly the gut microbiome that I'm talking about when I say that. And so what's made up of the gut? What can we find in the gut that's changing in a normal person without cancer versus someone that has cancer? And I think they're studying the difference between those two people and trying to figure out what is the difference. Is it gene related? Is it something else related that they can target and pick up in some sort of screening method eventually in the future to pick up colorectal cancer earlier? I know that's sort of a very broad sort of answer, but there's not necessarily enough research being done yet. But I know a lot of people are trying to study a healthy gut versus a gut from someone that's developed colorectal cancer. And if they can figure out what the differences between those are, then they have a better chance of figuring out ways to screen for what's happening with that change. Does that make sense?
Yeah, no, that makes sense. And again, any specific microbiome-related research that you've been looking at to inform you?
I am not in that field anymore, so not me. I merely focus on prevention and outreach and education. So my main thing now is my main, I guess, job duty and passion is going out in the community and educating the underprivileged, underserved minority populations that might be at higher risk or might not know about screening for colorectal cancer, to educate them about simple things like that FIT test is available to them when they turn 50 and they need to get it, and then that will let them know if they need to get a colonoscopy. I think that population has no idea that these simple take-home tests are available to them and covered by insurance. And so that's what I study now. So I can't really speak to the research that's being done in the microbiome. I just know that there is a lot being done. And as soon as stuff comes out, it pops up, usually on my my Google searches. So I'm looking forward to when more information comes out so that, I can help with it or that they can release it, and then you'll see it. I know you'll see all that come out because the news is covering the fact that younger people are getting colorectal cancer and people are trying to figure out why.
Well, I figured you'd be keeping your eye on it. That's why I wondered if there's anything new that popped up in your radar, but not yet. Okay. In terms of screening, whether people know or not to get screened, I would bet a lot of them just don't. What do you see that holds people back, if anything, about getting screened?
They don't know. A lot of the people that we see within the community, they don't know that they have this screening method starting at 50 that's very easy, like I said, very easy take home. We focus a lot on Hispanic, Latino, Vietnamese, and Asian and African American population because they're at higher risk for developing colorectal cancer. And so we educate the primary care physicians about making sure they communicate the right way to their patients, because I just recently read that 80% of patients 50 and above will get screened for colorectal cancer if their physician recommends it. So that recommendation from their provider is one of the most important things that a patient can hear. And, they have trust in their provider. So if they recommend it, they're more likely to do it. Also, there's this preconceived notion. I mean, the prep is not the greatest. I hope in the future they come out with a prep for a colonoscopy that's a lot better than what is now. I've had it multiple times. My sister just had one, and it's not the most pleasant thing to drink. I think also some people seem to not be able to maybe get time off of work because you have to take a day off to go in for the procedure, and it's usually about a half a day max, but some people feel like they can't take it off. But really, I think educating the population about if you take that day off and you're really looking out for your health, you could prevent having to get colorectal cancer. And if it's clean, it's 10 years before you have to get screened. And really, I think, the messaging saying, do you want to be there for your family? Do you want to be able to walk your child down the aisle? Do you want to see your grandson or granddaughter, being born? Really taking care of one's health is the most important thing you can do for yourself and for your family. So really, it's educating them that the screening is out there and that it's affordable and that it's accessible.
What's involved in a colonoscopy? If you want to give
Yeah. So basically, with a colonoscopy, you have usually, depending on your doctor's office, there's 2 days before your procedure, you go on clear liquids. and it can't have anything that has red dye in it, because red dye will show up as, something like blood. Essentially, you have to do the clear liquids 48 hours before, so that your system is at least cleaned out a little bit. And then, 24 hours before, you start this colonoscopy prep. And so there's various types of prep. The most common that's used within the U.S. is something called Go Lightly. And so you start drinking this prep usually in the early evening. About every 15 minutes, you drink this solution that you've mixed that's cold. You drink it, and essentially it clears you out. It cleans out your system so that the next morning when you wake up, and sometimes you have to drink again in the morning. It just depends. It's very specific on the prep, but the doctor always gives you specific instructions based on the preparation, the colonoscopy prep that they've given you. So you drink it at night usually, and then you start going to the restroom a lot. And then sometimes you wake up a few hours before your procedure and drink more. And then you should be sufficiently cleaned out. So, it sounds gross, but essentially you're going to the restroom, and it should be as clear as possible when you go to the restroom. And then when you go in for your procedure, you talk to your doctor, they give you some medicine. So essentially you won't feel anything. And, a GI doctor or an endoscopist will look in your colon through a scope and see if they see anything, anything in your lining that looks unusual, any precancerous polyps, any inflammation, any irregularity from a normal, essentially, colon, and then you're done. So that whole procedure, usually, if there's no complication, in and out, they're in and out in about 20 minutes. But, you have to drink the clear liquids, you have to drink the preparation, and if you do all that, 48 hours later, you get a clean colonoscopy. You don't have to do that again for 10 years. Now, like I said, it's a little bit different if they find precancerous polyps or other things within your colon. That's usually 3 years or 5 years, depending on what they find. But, that right there is saving lives, that procedure. So 2 days of, not being able to eat and, just eat, drink clear liquids, and, taking a half a day off of work is 100% worth it, versus, like I said, going through the cancer treatment, because it's a lot worse than clear liquids and a colonoscopy prep.
Why the half day off work? Because people sedated once they have the colonoscopy?
Yeah. You're usually lightly sedated. Sometimes you're fully sedated. It just depends on the doctor's office. But, even if they get you in for, let's say, a 7 a.m. procedure, they usually want you to go home after you're done, which will probably be by the time they intake you and get you back there and everything. It's usually about a half a day, and they usually want you to take it easy the rest of the day. So, I know some employers, that's a part of their wellness. So they let you take that time off and take sort of a sick day or a vacation day so that you can get all that done, because it is better for them as far as insurance purposes. Obviously they don't want any one of their employees to develop cancer, but, so the screening is encouraged. Just like women get their, like I said, get their mammograms and get their pap smears. Colonoscopy kind of falls into that sort of wellness. Your flu shot is another thing you should get. I think most people just have to, when they're at 50, it's one extra thing you have to add on to the list of things you should do to stay healthy.
So you're saying now the recommendation has come down to 45?
Yeah, so American Cancer Society has now recommended, based on research and a higher incidence in that 45 to 50-year age group, to get screening at that age. Now, that was just last year, so that sort of takes time to come down to the come down the ladder, so that it will eventually be covered within healthcare systems, hospital systems, insurance companies. So it's going to take some time before that recommendation is, I guess, implemented. But, I feel like people being even more aware that American Cancer Society now recommends it at that age, they're more empowered to ask their doctor at 45 about it. And like I said, different states are different as far as coverage for it at 45. So I encourage everyone to ask their provider at 45, or ask their insurance company, does this plan or does my coverage or does your hospital cover, colonoscopy screening starting at 45?
Mm. What about culturally? You deal with a lot of different groups, and I'm sure they have different thoughts about doing this, and social mores and everything. Anything you run into that's unusual or that makes this difficult?
I think that there's different, like I said, when I'm in the community, there's different communication tips that work with different populations. I think that within the African American population, there's research that shows that the woman sort of is the health decision maker. So if a provider can convince her to get screened, she'll go back and convince her husband to get screened. And so we really focus on providers communicating to the woman of the family that makes those major health decisions to make sure that she convinces her uncle, her brother, her husband to get screened. And then you have within the Vietnamese Asian population, these families are very, very close knit. And so within their population, you really want to find sort of the elder in the group, because they're the sort of leader of the family. And if they do it, then everyone else is going to kind of follow suit into getting screened. And then the Hispanic Latino population just needs to know that there's easy take home sort of tests. I mean, they all need to know that as well, but they're family oriented as well. So, messaging like, do you want to be there for your daughter's birthday or your granddaughter's wedding? Those are sort of communication tips that will help them think about the importance of getting that colonoscopy and how it's not just affecting them, it could affect their whole family. So I think the messaging of don't procrastinate, there's why you shouldn't be lazy about it. And there's a group called the National Colorectal Cancer Roundtable that just came out with a sort of communication guidebook for 2019 that kind of lists all the messaging that you should be using within your healthcare system that will be helpful in order to convince specific populations to get screened. So I've mainly focused on the communication tips that they had last year at this national roundtable. And so now I'm going to get more in depth within this to see what else I can take out to the local Houston community that I work with to help convince even more people to get screened. So there's different, I guess, reasons why specific populations don't. There might be, affordability, procrastination, knowledge, but we try to take all of those and make sure they have everything that they possibly need, all the knowledge they need to go and ask for that screening test, and they want to for themselves as well as their family's future.
Okay. What's the best way for people to find out more? I mean, we've given them a pass for most of it, but how can they get in touch if they have any specific questions?
They all can reach out to their American Cancer Society. They have a ton of information about screening, and they can read more information on there as to why they now suggest or recommend 45 for screening. We have a website on our page. Let me go to that right now, and I can tell you what we have information, and we have also videos we have a theater outreach program within our office where we have monologues in Spanish, in English, and in Vietnamese that kind of explain why screening is important and the importance of it in sort of, say, a comical way, but an entertaining way. And so that should help convince people it's another way to help convince people to get screened. So right. I say National Colorectal Cancer Roundtable is a great resource. American Cancer Society is a great resource. And then I'm looking up, I don't know, I need to get our website for you so I can tell people to look there too, because there's videos, there's education tools, and all of that. So if they look up the Daniel Duncan Comprehensive Cancer Center at Baylor College of Medicine, and there's a thing that says cancer prevention, that's where they can come to our website. I'm trying to get the exact, Let me get the www. I should know it off the top of my head.
No problem.
Duncan. So we have an email that's cancerprevention@bcm.edu if they want to find out more information about anything that I've talked about. We have experts that are out there that can answer their questions. And then we are www.bcm.edu/centers/ it should be, I think it's just cancer prevention. Let me look. It should just be an easier. I think it's just bcm.edu/cancer prevention. And, they can look on our website. Like I said, we have an online health library. We have information about our theater outreach program and educational resources. We have a volunteer program if they're local in Houston and they want to get more involved. I'm in charge of that volunteer program. We have on our website, we have a Facebook page and we have a Twitter. So the best way is to sort of look us up on the web.
Okay. Well, very good. Well, Allison, I really appreciate you coming on the podcast.
Sure, no problem. Thank you for having me.
All right, hold on a second.